can the VA use what you say against you and reduce your rating?
Whiskey 9 Yankee 7 November Golf, over.
If you're a fan of this channel, then you know that the best advice that anyone can give you is to gather your evidence. Whether that's from VA healthcare or from private, medical evidence is key. But it's important to be mindful about the words that come out of your mouth that are now included with your medical evidence. If you report that your symptoms have improved, or better yet, that you've been cured, the VA now has tangible evidence to use against you to reduce your rating. Now, do not let this video steer you away from healthcare. Healthcare is extremely important, and veterans, especially those that are not 100% P&T, need to upkeep your medical evidence. You can still complain about your symptoms and about your conditions without leading the VA to assume that your condition has improved. Here's an example of what this would look like. Hey doc, I'm here to talk about my mental health. All right, well, let's go ahead and talk about it. Well, I've been going to treatment, I've been going to counseling, and although I have learned some tools to help manage my symptoms, it's something I still struggle with every day, and it's slightly getting worse. Let's go ahead and continue treatment, and I'm gonna write a prescription for some medication. Now, whether you're open to medication or not, that's really irrelevant. There are some things I want you to identify from that conversation. One, the veteran was able to state that they are seeking treatment and they have learned tools to help manage their symptoms, but those tools are not the cure to their condition. In fact, the veteran stated that their condition is getting worse. This is an example of a picture-perfect way a veteran can talk to their VA primary care without leading the VA to assume that their condition has gotten better. When speaking to private healthcare, that's a bit different because the VA only has access to your private healthcare records if you give them access. With that being said, if you're gonna upload evidence in support of your claim, obviously you wanna make sure that the words that come out of your mouth that become medical evidence, you're gonna wanna make sure that that evidence actually supports your claim, whether we're talking about an initial claim for service connection, an appeal on a denial, or for an increase.